Hi, my name is Desiree. A little introduction about myself is that I have an undergraduate degree in psychology and a master's degree in prosthetics and orthotics. I have worked in the healthcare industry for about 5 years. In the last year, I have migrated into the field of data analytics by pursuing further education. With my specialty in healthcare data, my question is, how does the change in Medicare guidelines from November 2020 impact the preventative care of people with diabetes in the United States? So I'll do a little bit of a background. So this just goes over what diabetes is. The main issue that I see as someone who's worked in orthotics and prosthetics is that patients with diabetes will usually have ulcers and wounds. And the reason for that is a lack of protective sensation. And the issue with that is then that can lead to amputations of the toes or feet or lower extremities. I felt like this was an important question to ask because so many people are impacted. 1 in every 10 people in the United States have diabetes. And then also I thought this was important to ask because of the high amount of medical costs for patients with diabetes and insurance companies. So preventative care, what the orthotic industry would supply to these patients is 3 pairs of custom inserts, a pair of orthopedic shoes. Custom inserts are made to support the arches of the foot and reduce on any one area. Orthopedic shoes allow proper fit of the custom insert into the shoe. So what are the changes in 2020? There's restrictions to who the patient can see, so it must be an A or a DO. So usually that's the first roadblock, is it's difficult to get in to see your MD. And usually there's a nurse practitioner or physician's assistant, but those are not accepted under med guidelines. Also, the doctor must document all of the following criteria. There must be documentation of either amputation, foot ulcer, callus, foot deformity, poor circulation. There also needs to be a separate certifying statement that the doctor must sign. And then also there's a line where there must be an in-person visit to that doctor within the last 6 months prior to the delivery of the shoes. So as you can imagine, this can be kind of overwhelming for the front staff to make sure we have all of this documentation. The outcome of this, due to the difficult guidelines from Medicare, orthotic and prosthetic clinics have reduced the supply of custom foot orthotics and diabetic shoes. Companies have either stopped participating with the Medicare guidelines, therefore not providing this service, or patients pay out of pocket, which can be between $400 to $1,000. The return on investment is low on these products to begin with. They also tend to be the most time consuming with clinicians. So it doesn't make sense from a business standpoint to keep providing these items. My business question is, how does the increasingly difficult guidelines from Medicare impact the preventative care for beneficiaries with diabetes? My hypothesis was that there can be an increase of lower limb amputations due to reduced care and protection of the lower extremities. I thought that this was important because of the increased costs with surgeries and post-op care than the cost of preventative care. So I started out my research online. I was able to find the CDC website where I obtained this data. This just goes over the amount of people who've been diagnosed with diabetes annually. Then I was able to go on Tableau Public and pull up this graph. So I thought this would be helpful. As you can see on the right here, it has a bunch of different etymologies. So I was able to see just the dysvascular disease with comorbidity of diabetes. So that would be the number I would be interested in. So I was able to download this data as well. And then I was able to combine the 2 graphs and come up with my Tableau dashboard rough draft. So it would look something like this. The information on the bottom was from the Tableau Public graph that I obtained, and then the graph on top is from my CDC website. So I will need some additional data if I'm going to make this visualization support my hypothesis. So I think it would be important to note the number of orthotic and prosthetic clinics that have stopped or reduced diabetic care over the last 3 years. This is so I can show the correlation between amputation rates going up and then the clinics who provide orthotic care reducing over time. I also would need the amputation rate percent of total diabetic populations. The 2 graphs that I showed on the previous slide, that they are positively correlated, that's something that we would expect. So when the diabetic population increases, we would also expect the amputation rate to increase. What I would be more curious about is what the actual percentage of the amputation rate, if that goes up versus stays the same, expect the same just because the diabetic population is increasing. and here are my references. So overall, I would need more data to support my hypothesis and be able to appropriately show if there's an impact between O&P clinics reducing sales in custom foot orthotics and dive shoes and the increase in amputation rate. Thanks.